Primary nursing is what most people are familiar with. It's the idea that there is a physician or a physician assistant nurse practitioner and their nurse, and together they make a team, and they handle all of that provider's needs, whether it's rooming patients or calling patients back or handling refills. Team nursing is when you have a group of nurses, usually MAs or LPNs, that assist the provider in getting all of that work done. And most offices have examples of both types of nursing. Primary nursing and team nursing are on a continuum. So if you're doing CMI, you're going to do some amount of team nursing no matter what you do. But the variable is really how much of the nursing you do is team nursing and what stays as primary. So if you decide to stay with primary nursing, there are going to be a lot of new roles for the MAs to have in the new world. It's not just putting a patient in the room anymore. It's a lot of work before the visit. It's work on registries and trying to keep patients healthy. And so you're going to need some degree of teamwork between the nurses to get that done, no matter what model you employ. If you're already doing team nursing, you'll probably find that you are going to be sharing the work differently and maybe creating some new roles for team members that they either have permanently or that they share from day to day, just to make sure that the whole spectrum of work gets done. Changing from primary to team nursing is a big stress for the nurses and for the providers. So if you feel like, gosh, there's a lot on our plate, primary nursing is working well, stick with it. Just do that and add the team components as you go. If you feel like your primary nursing situation isn't working well, it's probably time to just go ahead and embrace the change and think about embracing team nursing. And if you decide you want to do team nursing, go for it. But what you need to remember is that because it's a change, people are going to need more support during that change, and you're just going to need to allow adequate time for meeting with people individually and talking them through the change, because change is hard for a lot of people. So as a provider in a team nurse situation, because I have many people helping me, I can't have my own super secret special way of doing things. I have to agree with my partners, and that really helps for standardization when it comes to the CMI process. Some of the things that I think can be helpful are setting up ways of expectations for communication in the clinic. So in our clinic, for example, we use iConnect, and there's an expectation that every pod of providers is going to be posting something to iConnect every single day, and that we all have to read each other's posts. And we try to make that as easy as possible to do, but that has really helped the communication keep going among all the people that are in the team. I also think people should consider having sort of a lead person for each group of providers within the clinic who's one of the nursing staff. That's the person who can be in charge of making sure all the staff are up to speed on anything that might be changing. They can be responsible for helping to make decisions about when you're sort of trying to choose between different options in the clinic. They can also do some of the training. And even if you're not going to use team nursing, having someone who's in that team lead type position who can help the CMAs and LPNs in their area really feel like they know what's going on, I think can be really useful. Healthcare's hard right now. I mean, it's hard for everybody, and I think one of the worries that a lot of providers have is I'm really doing my best every single day, and I feel like I'm working as hard as I can possibly work. How can you add something on top of this? And while CMI adds initially, it also takes a bunch of things away later. So what you'll see with that pattern of feeling challenged is that after a 2 to 3 week period of being challenged, then that's when the relief comes. That's when you see the benefit of that extra work, and it's pretty tangible and pretty right away. I think all clinics, in my experience, kind of break down into 3 groups of people: people that love change, people that hate change, and a big group of people in the middle. So for the change lovers, I think it's been great. For the people who really don't like change, it's been hard. But I think what they have found is that there's more help. You're not out there by yourself trying to get your provider's workload done. You have a team of people that helps you with that. That's been a big positive. And the other feedback I consistently hear from staff is that they can room for any person in the clinic. So if they don't get to work with their provider, they don't have that anymore, they're not worried about having a bad day because they won't be able to anticipate that person's needs. They know their needs because it's the same for every single person in the clinic. all of us as providers were worried when we started CMI about what it was going to mean. None of us really like to be told what to do. We like to be the ones that get to decide. But one of the real benefits of CMI, when you decide as a group and you pick a solution that's going to work for everybody, it may not be perfect, but it's good enough and you can move forward. What we found was that we get a lot more help in our day-to-day environment because everybody knows what they're supposed to do and they can help us. So there are still struggles whenever something comes up and we don't all agree as providers, then that can be a struggle. But the important thing is that we just have to sit down and talk it out, figure out something we can all live with so that the staff can support us to get the patient what they need. In the end, as a group, what we've said is that it's really the patient needs to get what they need. That's number one. Me getting my personal preferences as a physician is not on the list anymore. If my personal preferences lead to better quality for patients, it's on the table, we can talk about it, we can figure it out together how to deliver that. But I think what's been, even though it's been a challenge, the good thing is that when you empower your staff to think about things like improving the quality for the patients they work with every day, they come up with great stuff that you would never come up with as a provider, and then they can put it into action, and you're never involved, and those patients are getting better care. And that is really the amazing stuff about CMI.